Welcome to Your Health. I'm your host, Rhonda Alfred. Joining us on this episode is Dr. Jeffrey Rao, a plastic surgeon with Rao Plastic Surgery and Terrebonne General, and Tanya Mosely, one of Dr. Rao's recent patients, to discuss the DIEP Flap procedure. Welcome to the show, Dr. Rao and Tanya.
Hello.
Thank you.
All right, well, let's get started. We have a lot to talk about. Dr. Rao, please tell us more about yourself and your role at Terrebonne General and your surgery practice.
So I'm a plastic and reconstructive surgeon here at Terrebonne General in Marybird Perkins. I've been in practice for over 7 years, and a big part of my practice is breast reconstruction, and it's a big passion of mine and everybody at the office.
Okay, and Tanya, tell us more about yourself.
My name's Tanya Mosely. I'm from Houma. I was diagnosed with breast cancer at the age of 38, and now I'm 40, so I've been in for 2 years,
Okay.
and my surgery been going well so far.
Dr. Rao, let's get started with you telling us what is DIEP Flap breast reconstruction surgery and why is it different than other reconstruction surgeries?
So it stands for Deep Inferior Epigastric Perforator Flap Reconstruction. It's a complicated name that just names the blood vessel from where the tissue came from. It's the pinnacle, the best reconstruction in my opinion, and in a lot of people's opinion, for breast cancer. It's where we basically do an auto transplant of the tissue from the tummy to the breast. It's a microscopic surgery, so we got to carefully dissect out the little bitty blood vessels and sew them into the blood vessels of the chest to give the patient a very natural result.
And why was Tanya such a great candidate for this procedure?
Most people are candidates. As long as you're a general healthy person and you also have the tissue to transfer, you're a candidate. There's often other areas we can transfer from, like the thigh or the lower buttock, but by far the most common is the lower belly tissue that most patients are not mad to get rid of when it comes to reconstruction.
So it serves two purposes, really.
Right.
All right, Tanya, tell us more about your cancer journey and when did you decide, at what point in your journey did you decide to have this type of surgery?
I really wasn't going to do the surgery, but thanks to my fabulous, awesome, amazing doctor, he didn't give up on me. He made sure that I was more educated with it because a lot of cancer patients, breast cancer patients, they're not as educated as they should be when it comes to certain procedures that make them skeptical. So that was one of my main points.
And what was your experience like, and are you pleased with the outcome?
My experience turned out beautifully. He gave me that nice tummy and nice boobs when I look in the mirror, like I'm satisfied. Thank you, doctor.
She was definitely a person you had to keep pulling her back in. I'm telling you, convinced her I can convince anybody after.
It's a big commitment. It really is. And it's kind of scary, I'm sure.
Yeah. It was more like scary, like you didn't know, like sometimes you just don't know, but thank God I was blessed with a doctor that was able to break it down, explain, not only tell me, he was able to show me. Like,
drew everything
yeah,
out for you.
he just like, you're just not going to jump into it. He's not going to allow you to do that. He's going to make sure it's what you want. Even though he might think it's best for you, he's going to make sure it's what you want.
Well, that makes all the difference in the world. Dr. Rao, what are some of the benefits of this procedures for the patient?
When you're removing breast tissue, it's a lot of mostly fatty tissue, and you ideally want to replace it with fatty tissue. So the other option being implants, a great option. It's still not as ideal because it's a foreign material that you have for the rest of your life, and inevitably you have problems that need touch-ups, need things fixed. So the best thing about the flaps is that it uses your own tissue that loves you and will not have any problems down the road.
Tell us about the level of expertise it takes to perform this procedure.
It is the most advanced thing I do. I do a lot of complicated stuff, but it takes the most focus and the longest hours. The average surgery that myself and I also have a colleague, Dr. Mark Stalder, that assists me with it because it's so involved. But you're operating underneath a microscope for several hours on vessels that are as big as spaghetti, so very small, 2 and 3 millimeter vessels.
Very detailed.
And you can't mess up any of the vessels because they're supplying all the blood to the flap. So, it's a very complex procedure that we have gotten into a routine around here with and had some great results with.
What would you like to share with some cancer patients who are kind of on the fence about this?
Don't be scared, because it's a big step. But the thing is, they didn't want me to see something in the mirror when I look in the mirror, I want to see like it never happened. Like I know it happened, but I want to feel whole again. I want to feel more like myself, like something wasn't taken from me.
Right.
It's something that gives back to you. So just try it for yourself. You won't regret it. And when you see your results, you're gonna be scared. You're gonna be nervous, whether it come back or not. It's you have no control, but it's all natural fat. It's your own fat you're using. So they're just taking healthy fat from one part of your body and putting it somewhere else. So once I understood that, I was like, well, go ahead. And now I got my new things, thanks to Dr. Jeff, and
You're not
I love
reminded
it.
all
I'm
the
not reminded of my breast cancer, and now it feel good not to walk around with no problem.
And that is one of the biggest things I say
that is
at the first consult.
plus.
I say, my job
Yes.
is for down the road, you don't look in the mirror and think I'm a cancer patient.
I no longer see those scars. Like I see a breast, like I see like a nipple. I see I see a breast. Like
What you look like?
they nice. They look better than my other breasts that I had. So
Well, you can't be that. You can't be that.
it was a plus for me.
Well, thanks for sharing that information with us. So, Dr. Rao, how can someone schedule an appointment with you or a consultation?
So they can either look us up online at raoplastics.com or call Mary Bird Perkins to be in contact with us, or call the number at 709-0467.
Well, thank you so much for sharing your story with us and sharing your expertise, Dr. Rao. For more information about the DIEP Flap procedure and Terrebonne General Health System, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.